A new Tennessee drug overdose report shows just how deadly fentanyl has become and how it's affecting the older generation. There were more than 3,800 overdose deaths in Tennessee in 2022, according to the most recent data. And the ages with the highest increase in deaths were those in their 30s and 40s. News 2's Tori Gessner talked to a recovery physician who explains possible reasons for this shift. Tori.
The report is filled with data and graphs, but behind all the numbers are people, similar to those Dr. Chapman Sledge, Chief Medical Officer at Cumberland Heights, sees every day.
It's heartbreaking to see, the lives destroyed by addiction.
Dr. Sledge works to help them recover through treatment, but not everyone is that lucky. Now, many are falling victim to the synthetic opioid fentanyl.
It's never been more deadly to use drugs these days. Fentanyl seems to be ubiquitous. It's in everything.
The drug was detected in almost 2,800 of the 3,800 total overdose deaths in 2022, according to the report. Meanwhile, deaths involving heroin dropped significantly.
We're still in the third wave of the opioid overdose crisis, going from prescription opioids to heroin to fentanyl. And it's interesting how few people are dying from heroin overdoses these days.
Another interesting finding in the report: overdose victims are getting older. The age group with the highest increase in overdose deaths from 2018 to 2022, people 35 to 44. The second highest increase in those 55 and older.
There used to be a saying in this business, you don't meet very many old heroin addicts, but you see that these days, people that have been using for a long time and managing to survive.
Sledge says that's partly thanks to the increased availability of the overdose reversing drug naloxone.
Everybody should have this stuff, and it brings people back to life.
Something the data doesn't show: the number of people who survived an overdose thanks to naloxone, an event Sledge says is now viewed as part of the territory.
And the thing that just totally breaks your heart is when people that have basically died and have been brought back to life normalize it.
To put things into perspective, Sledge says in 2000, there were around 100 overdose deaths in Tennessee, a stark difference compared to the more than 3,800 today. You can read the full Tennessee overdose report on WKRN.com. Bob.